Welcome back to Diabetes Primetime, everybody. We're here with Endocrinologist Dr. Yasmin Khan talking about diabetes complications tonight. Answer our trivia question and you'll receive a delicious guide to diabetes superfoods with recipes. It's going to be a great show. Let's get started. Dr. Khan, thanks so much for joining us tonight.
Thank you. It's great to be here.
Well, our viewers always get to learn so much when you're on the show. And hey, folks, say hello to us in the comments and tell us what diabetes complication concerns you the most. Hopefully, Dr. Khan can help us alleviate some of those fears tonight. But before we get started, I want to ask tonight's trivia question. Answer the trivia question and you will get a really cool guide to diabetes superfoods that was put together by our diabetes dietitian. These are 8 healthy foods that we all should be eating more of, and we include some recipes in there to make it easier. So our question tonight, nephropathy is a complication of diabetes. What major organ does it affect? Is it A, the eyes, B, the heart, or C, the kidneys? That question again, nephropathy is a complication of diabetes. What is the organ that it affects? A, your eyes, B, your heart, or C, the kidneys? So Dr. Khan, when we look at the list of complications that can go along with high blood sugar, it can feel a little overwhelming. And we want to use this episode to cover some of the complications that we hear most often about. So let's start at the top of the body with a big one, the eyes. How can diabetes affect our eyes and our vision?
So diabetes can affect the eyes in many ways, and actually in many different parts of the eye. So one of the most common complications is retinopathy. So the retina is the back of the eye, and there's small blood vessels that are located in the back of the eye. With retinopathy, you can see that the high blood sugars do damage to these small blood vessels in the back of the eye, and that can lead to a loss of fluid or bleeding, and that can lead to vision loss. And when your eye doctor diagnoses retinopathy, they can grade the retinopathy. So in some patients, we see very mild retinopathy or more moderate or even severe retinopathy. And so the treatment will be based on that. So retinopathy is one of the main complications. Another area of the eye that can be affected is an area called the macula. So the macula is also in the back of the eye. And this is an area where you have that's responsible for the very fine and detailed vision. So if you get damage or swelling to the macula, we call that macular edema, and that can also lead to vision loss. So those are 2 of the main areas of the eye that are affected. But high blood sugars can also affect the lens of the eye. And when you have the lens that's affected, you can develop cataracts. So it's almost like you can see a cloudy lens from diabetes. So all of those are areas of the eye that can be affected, and that's why it's so important to get the eyes checked regularly.
Okay, so with all of these complications, I think I'm going to have 2 consistent questions. 1, how can we prevent problems from happening? And 2, what do we do once we have that complication? So let's talk about prevention first. What should people know about preventing eye problems down the road?
So, about 90% of vision loss can be prevented. So this is
Oh,
very
that's great
important to
news.
know.
Yeah.
And many patients will not have any symptoms of eye disease early on. So you don't have to have blurry vision. Some patients have normal vision. And so it's very, very important to just make sure that you're getting your eyes checked at least once a year. Now, if you have complications like retinopathy, then your doctor may see you more regularly every few months. If you are new to diabetes, so if you're newly diagnosed with diabetes, I recommend an eye exam, right at the beginning. So these are really important, to think about prevention rather than we wait till we develop symptoms from retinopathy.
Especially because it sounds like, as you said, a lot of times we don't experience symptoms. So if you're waiting for symptoms to decide, okay, it's time to go to the eye doctor, I don't want to say it might be too late, but you might have developed some issues that, you could have prevented had we been seeing the eye doctor. Let's talk about what type of eye doctor we want to be seeing. What is the exam that a person with diabetes should be making sure they're getting?
So I recommend a comprehensive dilated eye exam. The doctor should be looking at the back of the eye, looking at the retina and also the macula. And oftentimes a comprehensive exam will include a check of the pressure of the eye because glaucoma, which is elevated pressure in the eye, is also associated with diabetes. So once a year, make sure that you're seeing either an optometrist or an ophthalmologist, and they're doing a comprehensive dilated eye exam specifically for diabetes.
I love it. All right, so we've talked about prevention attention. Let's say that we've been diagnosed with an eye problem or an eye issue. What do we want to make sure that we're doing?
Well, the main thing is, the treatment will depend on the severity of the condition,
Got it.
the main thing is to see the right specialist. So, getting to the right specialist, whether it's a retinopathy specialist or a glaucoma specialist, but in any case, an eye specialist can develop a treatment plan. Sometimes those treatments include laser treatments or treatments with injection. But the main thing is to keep those glucose levels under control because all of these conditions can get worse if we're not maintaining good A1C results and also just maintaining good blood pressure and good cholesterol levels.
Know those 5 numbers. That's our number one mantra here. You want to know all of them because they're going to help you prevent complications down the road. So we have one question about retinopathy from Jerry. He wants to know if you already have vision that requires glasses. Is there a good way to tell when your vision problems are stemming from a diabetes complication?
Well, if you're having vision loss, the main thing is first to do the complete eye exam. Because even if you wear glasses, you still need to take a look at the back of the eye. You still need to take a look at the lens and check the pressure. So, vision loss is a common symptom, but you need to know why you're having that vision loss. So, even if you're wearing glasses, make sure you're still seeing the eye doctor regularly because you're looking for diabetic complications of eye disease. So, it's really important to get that checked out.
I love it. All right. Before we move on to our next question, I want to take a moment to thank our sponsor, Outweigh. As your diabetes health ally, Outweigh helps making diabetes management easy and affordable. Visit the link we're putting in the comment to get a free blood glucose monitor along with wellness materials to help simplify your diabetes management. Folks, don't forget, as Dr. Khan said a minute ago, it really is high blood sugar that's causing a lot of these complications. So know what's happening with your blood glucose and talk with your doctor about the patterns that you're seeing from checking at home. Also, Outweigh sponsors our trivia question, and just in case you missed it when we asked the question earlier, here's that question again. Nephropathy is a complication of diabetes. We're going to be talking about it a little bit later in the show. What major organ does it affect? Is it A, the eyes, B, the heart, or C, the kidneys? All right, Dr. Khan, neuropathy, different than nephropathy, but neuropathy is probably the topic that we get the most questions about on the page. So let's talk about that next. What is neuropathy, and why does it affect so many people with diabetes?
Well, neuropathy is one of the most common complications of diabetes, and neuropathy occurs from damage to the nerves. So, when you have high blood sugars, you get inflammation from these high blood sugars, and you can then subsequently have injury to the nerves. So, neuropathy is essentially injury to the nerves, and the longest nerves of the body are in the feet and the legs. So that's why we often see neuropathy in those areas. But actually, neuropathy can occur in different areas of the body as well. But with diabetic neuropathy, we often see it in the feet and the legs, and oftentimes that's after prolonged period of uncontrolled diabetes. However, similarly to the other complications, some patients at the time of diagnosis also have neuropathy. So it's a very common condition, and it is treatable.
All right, so Patrice is asking, how would a person get tested for neuropathy? And Dawn is asking, is that test painful?
Yeah, so testing for neuropathy, it can be done right in your doctor's office by your primary care doctor or your endocrinologist. Many patients with neuropathy will have symptoms. So some of the common symptoms are you can have pain in the feet or numbness or tingling. Some patients complain of a burning sensation or feeling very sensitive to light touch. So, sometimes we know just in speaking to a patient that most likely they have diabetic neuropathy. But the testing we do is in the office, and it can be done, at a routine visit. So one of the tests we do is called a monofilament test, and this is a test where we use a plastic filament and we apply it to the bottom of the feet. And we ask the patient if they're able to sense it or feel it. So if we notice that there's decreased sensation, then we know that that's a sign of neuropathy. Another test that we do is with a tuning fork, actually. So, tuning forks help us determine if a patient can sense vibration. So,
Ah.
somebody with neuropathy will not have a very strong sense of a vibratory sense. So, if we apply the tuning fork to the foot, and their sense is decreased to vibration, then that is also a sign of neuropathy. And once we make that diagnosis, sometimes we can start medication treatment. Sometimes we just monitor the patient. If the symptoms are not severe, you don't have to be treated. You don't have to take a medication. And oftentimes, if the neuropathy is more severe, will refer to a specialist like a neurologist. And the neurologist can do further testing for neuropathy and also come up with a treatment plan.
Okay, so what I'm hearing you say is if someone perhaps is having some pain in their feet, they want to go talk to their doctor about it, probably get tested for neuropathy, and then kind of figure out from there what the treatment plan is. Maybe it's time to see a specialist, and figure out, kind of go from there.
Correct. And every patient with diabetes should have, a yearly foot exam, at least once a year. And that foot exam will include testing for neuropathy.
And so if someone has the diagnosis of neuropathy, they probably want to be checking their feet every day as well, right? Making sure there's no cuts or wounds or sores.
Yes, correct. So, doing a daily foot check is just part of routine diabetes care for every patient. And, it's best to look at your feet either in the morning or the evening or around the time of a shower. So it's part of your daily routine. And you're looking for any signs of bleeding, cuts, sores, blisters, any signs of infection, anything at all. You can bring that up with your doctor. And it's always better to treat early because you don't want things to get out of hand when it comes to the feet. You're already at increased risk for infection when you have diabetes. So you have to be very, very careful with the feet. So just checking your feet daily is extremely, extremely helpful.
All right, last question about neuropathy. Rosalie would like to know if neuropathy affects your internal organs.
That's a really good question. So, neuropathy can occur throughout the body because the nervous system is throughout the body. So, the common place we do see neuropathy, as I mentioned, is the feet and the legs. However, the nervous system also controls the heart, also controls the stomach and the intestines. So, if you have neuropathy, if the nerves are damaged to the stomach or the intestines, you can have nausea, bloating, constipation. Sometimes you have delayed in gastric emptying, which means that the food doesn't move through as quickly. So sometimes patients will have nausea and bloating as a result of that. We call that gastroparesis. So
Ah,
yes, you can get damage to the nerves in other parts of the body. Similarly, you can get damage to the nerves that go to the heart or the cardiovascular system. In those patients, we see that when they rise from a sitting position, they might feel a bit lightheaded,
ah.
or when they're resting, their heart rate is elevated. So that may be due to autonomic neuropathy, which is neuropathy that affects the heart and the cardiovascular system. And also, sometimes a specific nerve in the body is affected. For example, a facial nerve or
Hmm.
a nerve in the hip or a nerve in the leg. So you can also have neuropathy that's specific to one region of the body.
Oh, interesting. I had no idea. And actually, I lied to you. We have one more question about neuropathy, and this is actually our Amazon Choice question of the month. It comes from
Right.
Michael. He wants to know if neuropathy is an inherited condition. And before you answer, Dr. Khan, a thank you to our sponsor, Amazon's Choice brand of blood glucose monitors and blood pressure monitoring products. They make healthcare more affordable. So what about Michael's question? Is neuropathy inheritable?
Well, the main reason that patients develop neuropathy is from damage from high blood sugars. So, whereas other complications have a stronger genetic component, for example, nephropathy, but with neuropathy, we find that the majority of patients are developing this neuropathy from prolonged high blood sugars. But genetic factors are always involved with type 2 diabetes because people who develop type 2 diabetes often have a genetic predisposition to diabetes.
Got it. All right, so we're going to move on to one of the most common complications of diabetes. Dr. Khan, you know how important it is to talk about, and that's heart disease. How common is heart disease among people with diabetes? Why should we be paying attention to it?
Well, it's extremely common. I mean, many patients with heart disease have diabetes, and many patients with diabetes develop heart disease. So there's a very, very close link. And for patients with diabetes, they have a several fold increased risk for heart attack, for stroke. So it's something that we monitor very, very closely. And that's why not only your glucose levels, but also your blood pressure and cholesterol, all three of these things are risk factors for heart disease.
Can I just
So this is always a priority.
put in a pause there? That's why when we're thinking about managing diabetes, we want to look at those heart numbers too. It's not just about A1C; it's
Exactly.
also about blood pressure and cholesterol. So keeping an eye on
Exactly.
all the numbers that matter is really important. All right, so
Exactly.
our first two questions about heart disease are actually about statins, the kind of the medication commonly prescribed to reduce cholesterol. Helen says that she's heard that there's a lot of negative side effects for statins. What are some of those side effects, and how common are they really?
Well, we get this question a lot in the office.
I can
So
imagine.
I can talk a little bit about statins, but first of all, I strongly recommend statin therapy. The majority of my patients with diabetes are on statins, and I recommend them. And that's because the benefits really outweigh any risk of a statin. So there's a very strong benefit to protect a patient from heart attack and stroke when they take statin. And the dosing of the statin depends on their risk factors, like their family history of heart disease, their age, et cetera. So, overall, I strongly recommend statins. There are some side effects, though, that you have to be aware of. The most common side effect is really some muscle aches or muscle tenderness. So sometimes patients will experience that on statins. And usually when that happens, we often will adjust the dose. Perhaps we might decrease the dose, or we might adjust or switch to a different statin. And often that takes care of the problem. So sometimes patients cannot tolerate a statin due to this side effect, and then we switch to an alternative cholesterol medicine. But overall, we try to stick with the statins whenever possible. Another side effect is that in some patients, occasionally you can see an elevation in the liver test. So we always check the liver test as part of the blood work for diabetes, and I always check the liver test before starting a statin. But in some patients, you'll see that the liver test may rise when they're on the statin. And if that's the case, if it's a mild elevation, we'll often just keep an eye on it. But if the levels rise significantly, then we may go ahead and just stop the statin.
So what I hear you saying, because this was another question we had from Nick, do the benefits of statins outweigh the risks? And what I hear you saying is a very strong affirmative.
Yes, the benefits do outweigh the risk, and it's a major risk factor for heart disease, diabetes is, and so whenever we talk about prevention with diabetes, this is what we're trying to prevent. We're trying to prevent a heart attack and a stroke. So any medications that we can prescribe that can help reduce your risk is beneficial.
So as always, folks, just a quick housekeeping announcement. We always want you to go talk to your specific doctor about your health situation to get the medications that are right for you. We're providing some general information, but you always want to talk to your specific health team to figure out your situation and what makes sense. All right, so speaking of medicines, Taniqua asks, are there medications for heart disease that might not be safe to take with medications frequently prescribed for diabetes?
So, I can answer that in another way too. There are many medications that patients take if you have heart disease that are protective. Similarly, for patients with diabetes, a lot of the medicines we prescribe are actually protecting from heart attack and stroke also. So many of the diabetes medicines are actually heart protective.
Oh, interesting.
Now, in some cases, for example, there are some heart medicines. The main one is a beta blocker. So beta blockers are used very commonly in heart patients, and they're excellent medications. But because they lower the heart rate, they can affect patients with diabetes. So, for example, if somebody has hypoglycemia, which is a low blood sugar, one of the normal responses to a low blood sugar is a fast heart rate.
Oh,
So
interesting.
when somebody's on a beta blocker, they won't see that fast heart rate. So they may not sense that they're having a low blood sugar. So I always tell patients if they're on a beta blocker, even though it's a great medicine, to be extra careful about low blood sugars. If you suspect that you might be having a low blood sugar, just check it. You may not always get the classic symptoms of low blood sugar, such as fast heart rate, sweating, feeling unwell. So sometimes you feel fine and you're having a low blood sugar, especially on a beta blocker.
That's a great suggestion. I think that's wonderful. What are some ways besides medications, and we're not knocking medications, but if someone wanted to make some additional changes, what are some other ways that people with diabetes can lower their risk for heart disease?
Well, there are several things you can do. The first is to stop smoking if you're smoking, begin a regular exercise program. And, I always recommend to do what works for you. You don't have to go to the gym if you don't like the gym. If you like walking, that's great. If you like dancing, that's great. So whatever physical activity you can fit in. And then, eating a healthy diet with vegetables and fruits and lean proteins. And meeting with a dietitian is part of having a good plan for heart disease and diabetes also.
I love it. All right, we could probably do an entire episode on heart disease, and I think we will next year. So if we didn't get to your questions, we will save them for next time. But I really want to talk about this next complication, nephropathy. This was the question for our trivia question. So those of you who answered C, the kidneys, you were right. Nephropathy is damage to the kidneys. So, Dr. Khan, talk about how diabetes can lead to nephropathy.
Sure. So similarly to the other complications, when you have elevated blood glucose levels, those blood glucose levels can go to the kidneys and damage the kidneys. So the kidneys are comprised of small units that filter the blood. So that's the job of the kidney, is to filter the blood. So when you have damage to the kidneys, that filtering system becomes ineffective. And so what happens is that the filter, actually, you can start leaking protein in the urine. So that's what happens when you have damage to the kidneys. So that's really the main way that the high blood sugars can affect the kidneys. And similarly to other complications, you may not realize that's happening. You may not always have symptoms, especially with early and mild kidney disease.
All right, so along those lines, Sherry is asking what symptoms should she be on the lookout for when it comes to nephropathy?
Yeah, so early on, you won't have any symptoms.
Hmm.
As the kidney disease advances, you might see protein in the urine, and we do a urine test at least once a year to check for that. Some patients with more advanced kidney disease, you can see some swelling in the legs. You might see a change in the urination pattern. But overall, many patients with kidney disease are without symptoms, and that's why it's so important to follow the blood test and the urine test for the kidneys.
And what is the number that a doctor might use? What is the test that a doctor might use to test kidney function? And should someone kind of be keeping an eye on it?
So the testing is part of just routine blood work that's
Hmm.
done at most of your visits with your primary doctor or your endocrinologist. So we follow a test called the GFR.
Hmm.
This is just a measure of how effective your kidneys are filtering, and there are other tests as well. But we do a urine test also to check for protein. So those are just the things that we do routinely. And the most important test is actually the blood pressure, because with advanced kidney disease, you can see high blood pressure, and also high blood pressure makes kidney disease worse. So I always emphasize that just along with the A1C, the blood pressure controlling the blood pressure is so important. It's just as important as controlling that A1C level.
Oh gosh, I'm so glad you said that. Ileana is asking whether metformin is safe for her kidneys. What would you say to her?
So metformin overall is an excellent medication, and especially for patients with type 2 diabetes, it can help you absorb insulin better. It helps you become more sensitive to insulin. So it's an excellent medication for type 2 diabetes, and it's one of the first line medications that we use. Now, metformin is safe for the kidneys. What we know is that if somebody has advanced kidney disease, we often will stop the metformin, and the
Okay.
reason is that metformin is cleared or eliminated through the kidney. So if the kidneys are not functioning properly, you can develop toxic levels of metformin
Oh
if you're
wow.
not careful.
Hmm.
So that's why if somebody has advanced kidney disease, we often will recommend stopping the metformin. But even with mild kidney disease, it's safe to take it, and it does not create the kidney problem. It's just that you have to monitor when somebody has kidney disease. You have to monitor the metformin.
Got
And
it.
oftentimes, if a patient has advanced kidney disease and I'm thinking about stopping the metformin, I'll usually check with the nephrologist or the kidney specialist, and we can decide together whether to continue the metformin or to stop it in that case.
So you've alluded to this earlier, but Robin is commenting that she had a urine test and it came back saying that there was protein in her urine, and she wants to know if there's a way to fix this.
Yeah, that's a good question. So, protein in the urine can be a sign of damage to the kidneys. Sometimes it can be from diabetes, but protein in the urine can be from other things too. So, for example, intense exercise can lead to some protein in the urine. Sometimes a
Hmm.
kidney stone or stress can cause some protein in the urine. So, always discuss with your doctor um, about protein in the urine and what the doctor thinks the cause is of that protein. But once you see the protein in the urine, we recommend treatment with medications such as ACE inhibitors or ARB medications. And these are very, very effective and excellent medications. These are blood pressure medications.
Great.
However, they also protect your kidneys. And they can delay the progression of kidney disease. So even if you have protein in the urine, just by taking these medications, in some cases, the protein resolves and you no longer see it. In other cases, you continue to take the medication, but the kidney disease does not progress. So these are really, really excellent medications that are used routinely. I'm sure many of you watching are taking these medications, but they're excellent medications to protect your kidneys. Even if you don't have protein in the urine, by taking these medications, you're protecting your kidneys for the future.
Gosh, that's such a great point. All right, Dr. Khan, last complication that we hear a lot about with diabetes is foot problems. And some people with diabetes have had to have an amputation. What should people know about the risk of amputation with diabetes, and how can they prevent problems with their feet?
Well, amputation is a risk that we all worry about when someone has uncontrolled diabetes. And I do think that it's preventable. So the first thing I would say is making sure that you're checking your feet every day.
Absolutely.
When patients develop neuropathy, they lose sensation in the feet. Therefore, it's easier for them to have an injury to the foot or an infection to the foot, and they may not be aware of it. When they're unaware, that infection can spread. Or that wound will not heal for a long time. And that's eventually what leads to a potential amputation. So I think the key really is to start early on, checking the feet early on. If you have neuropathy, treat that. Seeing a foot specialist too. So, this is important. All of the complications that we talked about today, even though your primary doctor and your endocrinologist may be screening for these complications, if you develop these complications, we often will refer you to specialists. So, seeing a foot doctor or even a vascular specialist if you have an ulcer in the foot or a wound that's not healing, making sure that you're seeing the right provider is very important so that you don't develop an amputation down the road.
Such a good point. And as always, folks, it's the high uncontrolled blood glucose that causes these problems. So by knowing your 5 numbers, trying to keep them to target, seeing your doctor regularly, you are really doing your part to prevent diabetes complications. They are not inevitable. Dr. Khan, thank you so much for joining us tonight. I always learn so much. I know our audience learns so much. Is there anything else we should know about diabetes complications before we let you go?
No, I think the main message here, like you said, is just that prevention is key. They're called complications because they don't have to occur. So, if you keep up with your routine visits, if you keep up with seeing your doctor, and sometimes patients think, well, I'm not doing well with my diabetes, so I don't want to go to the doctor's office. I don't want to find out what's going on. But believe me, it's always better to find out early on, and just keeping up with your visits, keeping up with your tests, no matter what's going on, just making sure that you're going through that. Will allow you to have less problems down the road.
I love it. All right, folks, join us next time on Diabetes Primetime on November 19th at 8 p.m. Eastern Time. Hope to see you then. Thanks so much for watching. Have a great night.